I know a lot of women use something known as witch hazel pads or a witch hazel wipe, but make sure you ask your doctor before you use anything. That way you get the okay and you don't bring further harm to yourself. Hello moms and dads and caregivers all over the world. Welcome back to Nurse Onyi Teaches. My name is Onyi and today I will be discussing some common signs and symptoms that women experience during the last trimester of pregnancy. If you have not done so already, make sure you hit the subscribe button and turn on your notification bell so that you are made aware of every time I upload a video. Now, if you are in the third trimester of pregnancy, you are in the home stretch. Some women are uncomfortable and they cannot wait for delivery. The closer you get those, the more signs and symptoms you deal with. And the ones we are going to be discussing today address not only the symptom, but some ways that you can manage them. And we're going to start right now. Symptom number 1 is known as stretch marks. Stretch marks affects a lot of women across the world. It usually has a genetic component to it, to where if your mom had stretch marks when she was expecting you, or her skin is prone to stretch marks, then you have an increased likelihood that you will deal with stretch marks too. Stretch marks can also happen if a woman gains weight too quickly while she is pregnant. Some of the things that you can do to manage stretch marks include keeping your skin moisturized, making sure you stay hydrated, and then make sure you gain weight steadily throughout your pregnancy. Sudden shifts in your weight can increase the likelihood of stretch marks, so make sure you pace yourself during your pregnancy that you gain weight at a steady rate. Be encouraged because for a lot of women, stretch marks can fade after their pregnancy. Symptom number 2 is known as swollen extremities. This is because as your pregnancy advances along, you tend to have increased volume of blood and fluids in your body. And also, as your baby grows, it puts more pressure on your legs and your feet. Your body also has a more difficult time returning fluids from those extremities back into the trunk so that it can be filtered out of your body. What you can do to manage these swollen extremities include elevating your legs when you sit down. Many women work on their feet and it's not usually convenient for them, but make the time to give your foot rest from constant standing. You can also wear comfortable shoes to help to deal with this. Now, on the heels of swollen extremities is another symptom known as leg cramping. Many women deal with leg cramping. Here in the US, or at least in the South where I reside, it is called Charlie horse. It is caused by an increase in the weight that a woman is carrying during pregnancy. It can also be due to decreased circulation in your extremities. It can be caused by a deficiency in some vitamins and minerals, or it can also be caused by extreme temperature changes. Some of the things that you can do to manage leg cramps include staying hydrated, taking your prenatals or antenatals as they are called in different parts of the world, making sure you do some leg stretching exercises, and avoiding extreme temperature changes. If you are dealing with a Charlie horse or a leg cramp, you can also flex your feet up towards your head and do that repeatedly to help to release some of that tension in your calf muscle. You can also press your feet down firmly on the ground or on the floor and take a few steps. That can help to ease that tension in your muscle. If that does not provide immediate relief, you can reach down and massage those muscles. The next symptom is something that a lot of, if not most women encounter during their pregnancy, and it is known as the pregnancy waddle. As your pregnancy advances along, your body will shift your abdomen forward, shift your buttocks and your lower tailbone region more to the back, and your hips will expand to make room for a growing baby. What that does is cause a woman to sort of sway from side to side as she walks. There's not a lot you can do about the pregnancy waddle. One thing you can do to help manage the waddle is to wear a nice supportive pregnancy belt that helps to control all of that shifting that your body does to accommodate the weight of your growing baby. Another symptom that a lot of women deal with during their pregnancy is hemorrhoids. Hemorrhoids are large and swollen blood vessels that can grow inside or outside of your anal area. Some of the things that you can do to manage this swollen blood vessels is to apply a warm compress to the external anal space. You can also get up and move around a little bit so that you are not sitting down for prolonged periods, which tends to encourage constipation. Now, hemorrhoids, when you have a bowel movement, tend to bleed. So if you are experiencing a lot of bleeding with your bowel movement because of hemorrhoids, make sure you reach out to your healthcare provider. They may be able to prescribe you some kind of cream to help manage these hemorrhoids better. I know a lot of women use something known as witch hazel pads or a witch hazel wipe, but make sure you ask your doctor before you use anything. That way you get the okay and you don't bring further harm to yourself. Another sign that a lot of women can notice as they near their due date is something known as lightening. And this happens as your baby prepares for delivery. What your baby does is, most babies anyhow, go into what is known as the vertex position, which is head first, and then they engage into the birth bone or the pelvic bone. When they do this, they give you a lot more room in your upper abdomen area, but they put more pressure in the lower abdomen area. Now, while a lot of women rejoice that because they can breathe a little better, unfortunately, that increased pressure in your abdominal area also means that you have an increased urge to urinate. You can also see an increase in the level of discharge that you experience. And then that increased pressure in your abdomen can sort of make walking a little bit of a task. If you are a first-time mom, lightening may occur for you a lot later than it would for moms who have had babies before. There isn't a lot that can be done about lightening, as it is your body's natural way of preparing for the birth of your baby. You can wear a support belt. I keep stressing that because 3 of my 4 pregnancies, I wore one too. I know a lot of women who have testified in the past to the amount of relief they get from wearing this pregnancy belt. Another symptom that a lot of women experience as they near their due date is something known as Braxton Hicks contraction. Braxton Hicks contraction is your body's way of preparing for the real contractions when you go into labor. Braxton Hicks tend to be irregular, they come and go, and they're usually not painful. If you deal with painful contractions and they occur at a regular interval, say every 5 minutes, every 3 minutes, you may want to get in touch with your provider. Now, to deal with Braxton Hicks contractions, you can just change positions, or if you are active a lot, take some time and rest. Changes in your activity levels can help you manage these Braxton Hicks contractions and allow you to continue your normal activities as you wish. I'm excited for you as you complete this last leg of your pregnancy, and I wish you a healthy, safe, and happy pregnancy. If you have not already, make sure you hit the subscribe button and turn on your notification bell so that you know when I upload new videos. And don't forget to give this video a huge thumbs up if you learned something from it. Leave me some comments in the comment section with any questions or concerns you have, and I will either address them directly to you or I will film another video, because a lot of times your question can be another woman's question. Come along with me as we build this community. Until the next time.